Good afternoon and welcome to the Interreligious Chaplaincy Program. My name is Kamal Abu-Shamsieh. I'm the director of the ICP at the Graduate Theological Union. We have a unique program today. It's a continuation of our highlight and exposure of international chaplaincy activities or programs. And today I'm honored to have, I'll start from what I have on my screen. At the top left, I have Reverend Ted Hodge. Ted, all of them, you'll have their biographies on the website of the GTU. We're not going to go through the entire biography. Ted is a Baptist minister, and he is the chairman of the International Committee for the Association for Clinical Pastoral Education, or goes by the acronym ACPE. On the opposite end, I have Dr. Jannah Raduan, who is a psychiatrist from Malaysia, and she was one of the students who participated in the recent training or clinical pastoral education in Malaysia. Next is Tahara Akmal, and Tahara is a certified educator with the ACPE, and she is a dear friend. We've known each other for many, many years. And also she is the first certified Muslim woman in the history of ACPE. And that's, congratulations on that, always the first in leadership. And we will be joining soon by Dr. Diana Katiman, who is a palliative care physician and also participated in this program. If you have any questions, by all means, please write them down in the Q&A. It will be easier for us to follow the questions that way. I will be also monitor the chat just in case if you'd like to have a conversation, we can incorporate your words as part of this discussion. And with this, here we see Dr. Diana just joined, going to her after her morning commute. Believe it or not, it's Thursday morning for her in Malaysia, and it is the last day before the end of the working week to begin a full weekend or a long weekend, Saturday, Sunday, and few days off for concluding a month long of fasting for the month of Ramadan. So welcome all of you to the webinar of the Interreligious Chaplaincy Program. I start with having the first part of the conversation with Ted and Tahara, and if you don't mind me calling you by your first names. And both of you are seasoned certified educators. And both of you are coming from two different unique traditions. Can you share with us, how was it for you to supervise a group of 10 students you've never met before in a different context, in a different country, and virtually?
So where do we start, Ted?
That's a good question. And another difference, Kamal, was that there were 4 different professions involved, and that's not typical in CPE. Doctors, nurses, psychologists, and chaplains. And I mean, it was a wonderful experience, and I think it was a very great experience. I wish we could do this more often, but it was not a common experience for us.
Yeah,
and for me, I had never done a virtual program, so that was new for me. Thank goodness that Tahara had and could be a resource to me. So we kind of had to depend on each other, and I think that helps, don't you, Tahara?
I agree. I think we complemented one another because I had the experience with doing CPE groups online or through Zoom or through video communication, and you had the experience with international groups. So I think we were a good team.
Yes.
And with the help of Dr. Diana and her leadership and Kamal also helping us, I think we did a really great job of bringing it all together. There were a lot of moving parts, I would say.
At one point, one of the students near the end of the unit did ask did you all know each other before this? And we said no. And I think they were a bit surprised because I think we did work together well.
Yes, I agree.
For the sake of our audience who never had this clinical rotation or training, can you explain to us what is CPE and how is it related to chaplaincy?
I think, Tahara, you might want to answer that because I know you had to do a presentation on that not too long ago. And so you probably can probably do that better than I can.
Okay, I doubt that, but sure. So clinical pastoral education it's ministry for, it's a adult education model for people who want to train to be a spiritual care provider, a chaplain, or they may want to work in another field like social justice work or work in a mosque, synagogue, a church. And what they're learning is how to provide spiritual care across faith traditions, across ethnicities, people with different identities. So what we do is we give people the opportunity to bring who they are from their spiritual or religious tradition, who they are as a person within their family system, or who they are in their personhood. And we bring all these things together in a CPE small group where people are learning how to engage with people who are different. How do you provide listening and provide comfort and support for people who might be of a different tradition, might be of a different gender, maybe different sexual identity, gender identity. So it's the people who come to take CPE with us are seminarians, lay people who want to learn how to provide pastoral care visits, maybe in their mosque or their synagogue or temple or church. We also have people who want to become a board certified chaplain. And in order to be a board certified chaplain, you have to complete some CPE units. So yeah, Ted, do you want to add anything to my description of CPE? I can't hear you.
You're on mute, Ted. Can you unmute your...
I might just add from our experience there in Malaysia that a part of that was focusing a good bit on emotions, which was not sort of a common experience of caring for others, as a way to deepen the connection and also to sort of deepen their awareness of their spirituality and the connection between our emotions and our spirituality. And so self-knowledge, self-awareness, learning with and from each other is an important part of it. For example, one of the things that I noticed when I first met our group was that I told a little bit about myself. This was just a virtual, and most of the students didn't, they just introduced themselves by name. So when we did our first retreat, I asked them to bring, or we asked them to bring pictures of themselves, their family, or their mosque, their hospital where they worked, anything that they were comfortable bringing. And it at least my impression was that it really sparked some deep sharing in a way that kind of surprised me, but I was delighted. And because I think that's part of what helps us connect is being able to share more from ourselves. And that is a part of CPE that helps us to then understand and relate better to others.
Mm-hmm.
I have two more questions, one for each of you, then we'll go and we'll bring in Jannah and Diana. For you, Tahara, I encounter sometimes students who are in the seminary or wants to become chaplains. They will do the CPE before they complete the certificate, or they'll do before they complete a certificate in chaplaincy. I get these kind of questions. Shall I do the certificate first? Shall I take few courses, then do the CPE? Shall I do the residency? Can you shed some light? What will be your recommendation as an educator?
Sure. And I think some of that, Kamal, depends on where they're going to seminary, because some seminaries might have it as a requirement that they take in the first year or in the summer. So if there's no requirement on them from their seminary, they may have some flexibility on when they want to complete CPE. So I think it depends on what their goal is. If they want to be a board certified chaplain, I would say to do that initial unit while they're in seminary, and then once they graduate from seminary, because a lot of the CPE programs that have the residency where they can complete 3 units within a year require that they have their Masters of Divinity completed, and oftentimes they will require that they have 1 unit of CPE completed. So I would say if someone wants to be board certified, that's probably a good route. If someone just wants to kind of test the waters and see if CPE is something they even want to be interested in, or chaplaincy is something they're discerning, would this be a second career or something I'd be interested in? I would say take an initial intern unit where someone can go in and either do an extended longer unit, depending on their family needs or personal needs, or maybe a shorter unit, a part-time unit, and to experience what it's like to be in a hospital where you're providing care for people in different situations. And I think that first initial unit will give people an idea of where they land, what's their comfort level, how they connect, or maybe feel disconnected. But I think those are a couple paths. There's a lot of different, dynamics that may go with that. But I think in general, that would be a good plan.
Thank you. Ted, you are the head of the International Relations Committee, and we have, as I mentioned, some students who might be interested in going outside of the borders of the US to do CPE. Can you share with us what countries we have agreements with, and if there are countries without agreement, what will be your recommendation?
Yes. Right now, we have a reciprocal agreement with Canada, with Australia, New Zealand. We are just about to finish up one with Ireland, and we have one with Norway. Those are the countries that where a unit would be recognized if a person did it in one of those countries, or vice versa. If they did it in the US and they were going back to one of those countries, that unit would be basically seen as equivalent. As far as other countries, there is CPE in some of the other European countries. I know in Germany, and there is in Hong Kong, and we do have, it's not a reciprocal relationship, but in Hong Kong, and actually I did 2 units of CPE there back in the 1990s, and they have their own Hong Kong Association of Clinical Pastoral Education, and a number of other countries may have CPE that's very similar to what we do in ACPE, but it may not necessarily be recognized. But so it would be helpful maybe to talk with the national office if somebody had a specific request about wanting to do that somewhere else.
So if we have a student who is interested in a country that is not represented as part of the countries you share that we have agreements, shall they speak to you directly, or shall they go to the ACPE for advice?
I would suggest they go through the national office, because they might not reach me directly, but if I need to be involved, they'll contact me from the national office. Yes.
Wonderful. Thank you so much.
Mm-hmm.
And now we would like to, how about if you introduce the students that you met as strangers about a few weeks ago and now meet them on a different level? Tahara would like to introduce the students.
Sure, I would love to. I will start with Dr. Jannah Katiman. Dr. Jannah was very instrumental, again, like I said earlier, in getting all of this together. And when Ted and I were like, and we said we're gonna need to ask Jannah, he was there for us. So do you want them to speak after I introduce, or introduce them both?
Yes, sir.
Oh, both, okay. Dr. Jannah is a palliative care physician in Malaysia. And then we have Dr. Jannah, and actually I had the pleasure of supervising both Dr. Jannah and Noor. She is a psychiatrist in Malaysia, and also was, part of our group. So it's so nice to see both of you.
Thank you for inviting.
Thank you, Tahara.
You're welcome.
Now we want to ask the participants, Dr. Jannah and Dr. Jannah, can you share with us why did you decide to have CPE in Malaysia? What is so significant about this program for you?
Jannah, do you want to go first, or shall I?
No, I give the honor to Dr. Jannah.
Thank you. First and foremost, thank you, Dr. Kamal and ACPE for inviting us to to join this sharing session. And I do apologize earlier that I couldn't switch on my camera. But going back to your question, why did we start off? Well, personally for me, as a palliative care physician, I was always taught that spiritual care is part of palliative care. However, when we were undergoing our training, we found out that we thought we knew what spiritual care is, but essentially we didn't. So the opportunity came when Dr. Kamal came to Malaysia. He did some spiritual care training for some of the healthcare providers in Malaysia, and I had the opportunity to join in one of those training. And it's as if like a door opened up and, you know, introduced me to this world of deep emotions, and then being able to open up. And then I instantly realized that spiritual care is something that is often misunderstood in Malaysia. And we need more people who understands it, and also we need more people who can actually practice it in that setting. So because there were no ACPA accredited training courses in Malaysia available, so we had no choice but to organize it and then participate it ourselves. So I had to thank Dr. Kamal and CPECC, Dr. Kidoan, for assisting us, and were very instrumental in helping us set up the unit here.
Thank you. Yeah, can you, either one, Jannah or Diana, share with us what kind of, you mentioned misunderstanding or different understanding of what spiritual care is. Can you share with us what was that misunderstanding, or still remain among those who were not exposed to CPE?
Well, for one, when we first started, or even until now, I think there's a lot of misconception with regard to the interchangeable definitions of spirituality and religiosity. So in Malaysia, where the majority of the citizens are Muslims, and who are practicing Muslims, and religious rights in the Islamic culture is very prevalent here. So people kind of misunderstood spiritual care as being religious care, meaning, you know, teaching people how to pray in their illness, during their illness, and also how to, you know, relate, think of spiritual care at the end of life. For example, in my area in palliative care, it's just, you know, how to connect the patient to the Supreme, to God. But that is the misconception, because, you know, religiosity or the religious acts is only just a small component of spiritual care. So that is one of the major misunderstood or misconception of spiritual care in Malaysia at the moment.
Yeah, I agree with Dr. Diana. When I first heard about CPE and spiritual care, it was just 2 days before the deadline. I bumped into the flyer. Thanks to Dr. Diana, she helped me to ease my application. And I have to actually share this, that just answering those intake application forms really changed how I felt about, you know, knowing myself to begin with. And I realized that, wow, this is really a different kind of training, a different kind of learning, just by answering that intake interview application form. And I think that was just the starting point, Kamal. And once I came into the first 0.5 units in 2020 and subsequently recently, I think the learning never stopped. And even though the training has ended after 8 to 10 weeks, I was still learning about myself, and I could, you know, connect and relate better to my patients. Well, in psychiatry, because we do a lot of psychological interventions and interviews, our approach is similar to palliative, where we use biopsychosocial spiritual approach. But I have never able to find that spiritual approach that was making me able to sync with my patients, regardless of their different backgrounds, different religious faith, you know. So when I went into this training, I realized that there was really a missing link when we talk about spiritual care in Malaysia, where it was mostly like how Dr. Diana said, it was a lot about religious practices mostly, but we do not really dwell into the deep side of the spiritual needs of the patients. So this training really made me learn how to connect spiritually with my patients. and not just trying hard to make them connect to the supreme only. There was other components and I think other dimensions to the spiritual care that I was able to deliver to myself and the patients. Yeah.
So far, I have been hearing a lot of difference. I am hearing misconceptions or understanding of what spiritual care is all about. And yet you completed an intensive 6-7 week of spiritual care or CPE that the way it is done in the United States. And for example, Ted mentioned that as part of the introduction, asked you to share a photo of yourself and to talk about yourself and your family. Is this something traditional? Was it difficult for you to share a bit about your own personal life? Diana?
Well, thank you, Dr. Kamal. It's not new, it's not novel, but the way that Ted shared his background on a very deeper level to us, that was the difference really. So you know, we've already done introductions and showing picture and telling about yourself, but I guess it's the layers. It was deeper, and we really connected as a group. We really connected instantly with both our educators, and I think that showed the way for us to be able to be you know, authentic and then expose ourselves essentially what are our fears and what our concerns are from within ourselves. So that was new. That was new.
The second point.
I think, sorry, I just wanted to add to that, Diana. I think that introduction part where we really introduce ourselves, that was really something new. I've never done that before ever during my training. So I think not only I learned about myself, I learned about how having an educator, you know, like Ted and Tahara, opening themselves up, making it safe for everyone else to open up and accept us as who we are. So that was very precious, I thought. It was a learning that I think I've never taken from anywhere else in my training. Sorry for the
That's all right. I'll focus on Ted and Tahara for a second. You mentioned that this group was unique in the sense that not all of them were seminarians or studying religious studies. They were interdisciplinary. We have physicians, we had nurses, chaplains, and counselors. How did that mix up work for a CPE to train all of them to understand what is spiritual care and to provide it as well?
I would say that it enriched and deepened the learning experience. I think even though all folks work in a hospital setting, or well, except for the psychologist, I would say even here in the US, we don't always get to know people who are in the same area helping, but we don't know them at a personal level. And I think it helped each group to kind of be aware of some of the special struggles and issues that they deal with, but also some of the commonality of that's there between us as human beings. That's the first thing that just kind of comes to me. And I think the fact that all of these folks have worked in a hospital or worked with people for over 2 years full time, it led to a deeper kind of sharing and connection with their patients. And so the verbatims, the cases that they presented, I mean, I was, and I think Tahara and I talked about that, amazed at the depth of sharing and connection. Tears were shed by a number of the patients. Tears were shed by the students and by us as we dealt with some of these really tough situations.
I remember us, I think in the group talking about how the patients, it just felt as if what the what the professionals actually were offering their patients seemed to be something needed, because the level of sharing that they did with you all, the level of emotions that they shared, you all were, and I think that might be connected to how you all shared that in Malaysia. It's not common for someone to ask, how are you feeling, or asking you about your emotions on a deeper level. So I was so surprised, pleasantly surprised, how much people opened up to you all, and just would cry and just share their heart. And I think most of the time, if I remember, or maybe half, I'm not sure, it wasn't about religious matters. It was about their families. It was about, their situation. Is about loneliness. It was about grief. It was about so many other things. So I thought that was unique. And I think also the fact that all of us were trying to come through COVID, and how we all could connect on that level. Whether you were a physician, a chaplain, we could all connect with people in their suffering and their struggle with grief, and our own grief and suffering through COVID. So I thought that was a common place for all of us as well.
And some of the cases that we dealt with were very difficult, but in some ways, particularly as a Christian and from the US, helped me realize people are people no matter where they are. I mean, one case, there was a young unmarried teenager who came in with a miscarriage, which, in the Muslim faith, that's difficult to wrestle with. And how do you not be judgmental, and how do you listen and help this person, a person who is struggling with their faith, and having questions and doubts, and from an angry parent who was angry because their child's surgery had been postponed, and was yelling at the nurses, and the chaplain came and was able to really help the person through this. I mean, those are just a few examples, but there were many of these kind of cases that seem to have a more depth, I think, than maybe the average student who has never been in a hospital before and is visiting with patients and just trying to learn how to be able to connect with them at a deeper level.
If you allow me, before we go into the context of some of the cases, because I'm very much interested in hearing how is that or happen in real life, to have cases and to discuss those, but the learning method I'm interested in. And in some parts of the world, there will be that learning method of what we call banking, where this expert would come in and share knowledge, and it's up to the student to retain as much of that knowledge. And then you employ a completely different form of learning, the reflective, the action reflection model, where you come in and reflect on the situation, you reflect on feelings, you reflect on performance. How did that work to bring or to bridge the two methods of learning, or did you bridge the two methods?
Is that for any of us?
Yeah.
One of us?
Anyone?
Well, maybe I can have a go at that question. I guess the methods of teaching and how it is conducted is fairly new for us. Definitely for me, I've never done verbatims before. And the IPR sessions and also the individual sessions actually showed us how spiritual care is done. Not really just the didactic parts of it, but as I went through the individual supervisions with Chaplain Tahara, I felt also this is what spiritual care is. I felt like my spirituality is being healed as I was having the sessions with Tahara, and in the group, when people were validating or affirming the verbatims that I wrote, so it felt like, I am the patient, and I can feel it myself that if I were delivering spiritual care to that patient, this is how I would feel. So that sort of concept clicked us through the practical part of it. So that is something new, and I think we're not used to it. Definitely not me in Malaysia. So that combination of didactics and also all the verbatims and the IPR individual sessions all reinforce that learning.
Yeah, I agree with Dr. Jannah with regards to the new way of that learning method of verbatim. Sharing verbatim is not new to me because I've been doing verbatim sharing during my master's training in psychiatry. The difference in CPE is that the feeling I had, that apprehensiveness I used to have during my master's training when I shared verbatim and during spiritual care is very different. I think the fact that in CPE, the conduct of learning, the method that is, I guess, very important or prominent to me is that suspending judgment, that I know my educators would be able to highlight and affirm what my strengths are, and then subsequently followed by either curiosity or that growing edges was very hopeful, was very helpful, whereby I am waiting to hear from my educators to share what were my growing edges, where should I improve, you know? And I've not felt this way, I guess, throughout my medical and master's training. I think because our background, like at least myself in either medicine or psychiatry, is that we are very task-oriented, I guess. So we are always trying to achieve objectives, but there is no specific objective where we look into, hey, I've done this, you know, and I should acknowledge myself where I've done this and I've done that. So I think in our background of caregiving, especially healthcare workers, we don't really pause and reflect what our actions were. We were always looking into maybe what we could improve all the time, but we rarely acknowledge we've done this right. You know, this is our strength, you know. So I thought that was very, very amazing and excellent, because I learned a lot through it myself during CPE. So I think for me, that was the strength of CPE that I learned a lot from. And sharing verbatim was definitely more educational for me in CPE, because I learned to see a lot of other dimensions from it. Suspending judgment between the educators and ourselves, and allowing to have, as in like allowing each of us to have our own judgments and allowing that to flow was also very powerful. Yeah, so I thought that was a powerful part of learning in CPE.
As part of that, or as a result of this experience, and this question for, again, Jannah and Diana, did you incorporate any changes in your own practice, in your relationship with your patients, in how you communicate with them, for example?
Yeah, I feel I have changed, and I have to say, I have to like express my gratitude to Rod as well, because I thought that he had actually you know, plant very good solid foundation for us on how to listen. And so that that skill to listen intently that we had 2 years ago with Rod, and then we grew it further with Ted and Tahara. I think that helped a lot. So like Jannah was saying, like before this, like being trained as a physician, as a doctor, you kind of thought that when you see a patient, you have to cure the patient, treat something, you know, you have this problem, you have to treat it. But then having gone through the CPE, even though it was just 1 unit over 2 years, which is a long time, but at least I thought that I'm able to, you know, assimilate between the two. Previously, I had this problem of like going in and seeing patient and then wearing my physician hat. Whereas I think in this session, I've been managing to be able to do both, like doing spiritual care as well as being a physician. So that skill I thought was very powerful for, and I'm very appreciative that I'm able to learn that skill.
How did your patient receive that? Two identities, one being a spiritual care provider and one is physician.
Well, I never really asked my patients, but I do find that they open up a little bit more, and my consultation seems to be a bit longer than usual. But I have the pleasure of having one of my nurses with me as a CPE student, and we always, discuss our cases and then relate it to what we have learned in the CPE unit. So I'm very grateful to have Staff Nurse Amy around, and we were able to reflect. And she also told me what I did good and what I did bad, and I also commented and reflected together with her as she was doing spiritual care. So that was very helpful.
Ted and Tahara, would you like to add anything else about the students and the learning edges before we move on to the general population that you are dealing with?
Well, I was going to go back to your original question about, the sort of a didactic type of learning and present. And we certainly did have some of that. We actually, and I did this a little differently because I wanted to include the students in on what they would find to be most helpful. And we had a list of about 16 different didactic topics, and they rated them, especially with, again, Dr. Diana's help. Sometimes I was thinking we're going to have to do this, but she would just take it over and poll the students, rest of the students, and get back to us. That was such a gift, especially being, 12 hours difference part of the unit and 13 hours the other part. And that was another challenge. Is just like right now, it's morning there in Malaysia and it's night here in the East Coast. But so we had I guess we had at least maybe 6 different presenters to do didactics, which again gave some different perspectives. And Kamal, you did one, which was very well received. And then we had several other of some of your folks who are Muslims who presented. And I thought that was another rich part of the program was trying to offer didactics in consultation with the students, not just us deciding what we're going to present. Anything else, Tahara?
Yeah, I want to add to what you're saying and then connect it to something that Dr. Diana and Dr. Jannah were speaking about. A unique dynamic in CPE training is that the students create their own goals. So we have the curriculum, but they create their own goals. And Dr. Diana, you touched on one of your goals, if it's okay to say that one of her goals was to navigate her dual identity. Sorry. Her dual identity as a palliative care physician and a spiritual care provider. And so that was something specific for her in which, she needed to learn. And all the students had different learning goals. So it makes it very personal. Not only do you have the curriculum, but the students are working on 3 areas that they've either gotten feedback on. It's something they really know about themselves that they feel they need to, it's a growing edge and they want to work on it. And they get to present their goals to the group, and everyone helps them to massage them and kind of get them clear so they have a path for themselves as they're working through the CPE unit. So I just wanted to mention that. That was another unique dynamic that I think worked out very well too.
And I also might mention that evaluation is a very significant part of the CPE process. Evaluating yourself, getting evaluation from your peers, from your educator. As one of our other students, Dr. Mazia said, it's like a 360 evaluation, which some people are familiar with. You get feedback. And in our final group evaluation, folks did share how they had worked on their goals, and then they either gave a blessing and a hope to their peers, or they used images and did such a creative job, many of them, with cartoon characters, movie characters, with pictures, and it was a rich experience. But I think of what Dr. Jannah said earlier, it wasn't just pointing out what you need to work on. It was a mixture of affirmations and potential places to continue to grow.
For the sake of those who have never heard of Malaysia before, can you share with us your country? What's the highlights of it? What are the people that you work with? What's their background? If that is possible for you to share with us.
I'll just say the demographics then. So Malaysia is in Southeast Asia, with Singapore and Indonesia, in Thailand, with that area. And we have a population of 30 million people, and the majority are Malay Muslims. And then the rather large cohort would be Chinese Malaysians, and then Indian Malaysians, and then there are other like races in Malaysia, but like we are multiracial and multi-religious society. So that's some of it. Maybe Dr. Jannah wants to add more about the highlights. You can come to Malaysia and visit, we'll bring you around.
Yeah, despite us being multiracial, we are very confined to our faith and religious background. So we are very intercultural when it comes to holiday celebrations. We are very open to visit each other during holidays and celebration. We love holidays and celebration. However, like, you know, like CPE itself, like the first time we had Rod as our educator, and he's a reverend, and Ted is a pastor. So this is really, really different and like never happened before, I guess. I think, I mean, I may not know, but through my knowledge, like we have never learned about spiritual care. I mean, if we bring this into the community, they will be very like skeptical about how do you learn spiritual care from a pastor or a reverend. You know, it's like something that you really have to think about the sensitivity of it all. But being in CPE, I realized I learned a lot from Rod and Ted on top of Tahara. I mean, I share a lot of similarities with Tahara because we share the same faith. But with Ted and Rod, they have really opened up, you know, how I look into different religion and faith, and it really helped with my clinical practice and also just my social interaction with other religions in Malaysia. So although we are, you know, multiracial and we have a lot of faith, but I think the approach between one another has been quite encapsulated to our own faith all this while. So CP has opened that up. I feel more comfortable talking about interreligious discussions and faith with my friends from other faith and my patients from other faith. So it's easier now with the CPE.
Kamal, I'm not from Malaysia, but I have been there twice after I supervised in Hong Kong, and it's a beautiful country. They didn't mention that, and, you know, with mountains and beaches, and it's actually separated. There's part of it's on the island of Borneo, and one of our students actually climbed up the highest peak in Southeast Asia, which is Mount Kinabalu, and I did that back in 1994, I think it was. So I was hoping to get to go back, and I still hope to go back and meet you all in person.
Yes, definitely.
We hope so too.
Really looking forward to seeing both of you.
And another good example of that was one night when I was there, I was in Malacca under a mosquito net, and it was, and I was burning up. It was so hot. The next day, I was up in the Cameron Highlands where there are tea plantations, and there was a fire in the fireplace, and I had blankets on the bed. So you can see it's a country with a lot of other kinds of diversity too.
I've been lucky to visit Malaysia several times, and I cannot even count how many times I've been there. And I share with you the enthusiasm that definitely is a very beautiful country, and the goal is to go back. With the population itself, what I encountered is sometimes tension, religious tension, primarily with Muslims and Christians there. And having both of you work with two supervisors, one is Muslim and one is Christian, what kind of concerns played out in the few weeks you were studying together or supervising, and how did you encounter them?
Well, I think both Ted and Tahara, and also Rod before, we've no problems with them. I mean, we're really appreciative, and I think we really opened up and connected at quite a deep level. But I'd just like to say, before we even started, as we were making the proposals and I had to sell this idea of conducting CPE, they've never even heard about it. They don't even know what spiritual care means, And then the first educator was Rod, and he's a reverend. And I have to sell that idea to multiple institutions to get the buy-in for them to send in people. So that was quite hard. And like Jannah was saying, so that was an uphill task, but once they understood what it meant, there are evidence in their researchers internationally about the association of spiritual care with healthcare. And once I approached it in that angle, and they understood about it, so then the stakeholders bought in the idea, and then after that it was a bit easier. But still, we are still at that, we are not even at the policy making level, we're just like in the management level to roll this out into the public, into the community and teach them, or, bring spiritual care to the society. I think that would be another task ahead for all of us.
That's true. And Kamal, I just really need to congratulate Dr. Jannah for really, bringing this idea and, trying to convince everyone. Because even the first time I heard that, oh, okay, our educator is going to be reverend, I had my, the first time I also had my, doubts. But then Dr. Jannah was like, but this is about spiritual care. And I guess just bringing, the first time you hear that idea is really, because it's a different thing. And when it opened doors, when Dr. Jannah opened the doors for it to actually happen, I was so grateful that I was part of the group, because I learned a lot from Rod and Ted, and it really helped to enhance my own connection to my faith. And I've said this a lot of times before, because it is really amazing to just, go through that journey of realizing that. And really, I thank CPE for that.
After this unit has concluded, what are the future plans for you in Malaysia? What do you hope to achieve?
Well, over the last few days, as a group has been discussing about this, what the future holds. And some of us were excited to actually think about doing residency, but there are a lot of logistic concerns to address before we can actually do our residency there. So the second option would be to conduct more CPA trainings, although it will take longer to complete the 4 units, but I don't know, we'll have to, group together and plan ahead. We really need your support on this also, Dr. Kamal.
Absolutely. How about you, Tahara and Ted? What do you think should be the next steps for communities, whether be it in Malaysia or other places, who did not have that prior history with CPE and with the style of learning and the interdisciplinarity of it, and facing a lot of hurdles, be it trying to explain it to policymakers who might be skeptical, or at least just not knowing anything about it?
Well, one of the things I think is that the CPE group in Malaysia is a great model, because it's the interdisciplinary team within the healthcare system, learning leadership, learning spiritual care, learning how to integrate their role as a professional, and also how they integrate spiritual care into that role. There's been some research and some articles that have been out about, doing CPE for people within the interdisciplinary team, and not just for people who want to become a chaplain. So thinking about in the future, I think that would be a great model, that others on the interdisciplinary team have some of the skills that we use, like listening and presence, assessment in a different way, where you're assessing spirituality and what's meaningful rather than religiosity. So I think this model that we have in Malaysia is excellent. And it's something we can hold up for other hospitals, other people who want to think outside of the box of what CPE has been and what it could be.
Yeah, and I wonder too if there are others who could benefit from this kind of training, and if you're going to do interdisciplinary, would it be possible to even have a couple of administrators who would be included in this that might, you know, get a different view of what spiritual care is? And that may be impossible. I don't know. And I'm not sure what direction to go, whether this group should continue to do more CPE or whether you ought to sort of be like evangelists, you know, getting some others, or I don't know how many other hospitals there are, places where, you know, you could have a larger group of people who've at least had one unit of CPE. I know in Australia, when I did CPE there, they don't have any residencies. Even in that country, the hospitals don't pay for a person to do a year of training. And they have chaplains in hospitals who have only done one unit of CPE. So, there are different models for how you can do this. In the US, I know many of our hospice chaplains only have a couple of units of CPE, some of them. So there's not you don't have a body that's going to tell you this is what you have to have in order to do this. So I would just sort of do some brainstorming and what might be some creative ways to continue to expand the awareness of what spiritual care can be.
And since we are on the international scene, I want to go back to a question from one of the people in the audience. Her husband is in Ireland or from Ireland, and she's planning to move there. And you mentioned something about an agreement with Ireland. Yes. What's your advice? What to do next? How to connect with the group? What kind of CPE is available for her in Ireland?
There are only 5 educators, supervisors in Ireland right now. So it's not and I think they're in Cork and in Dublin. So I'm not sure where this person will be stationed, but if that person would get in touch with me, I can at least give them the name of the people that we have had contact with and perhaps can explore with at least one or the other of those people what the possibilities are.
Wonderful. Since she is one of the students in the Interreligious Chaplaincy Program, I will share your email address with her and we'll have both of you connected together. We have 5 minutes left for this program. Wonderful, beautiful sharing. What last thoughts you would like to share with those who are watching, and how can we at the GTU support you further with your journey into chaplaincy?
I'm lost for word really, but I'd just like to say thank you, Dr. Kamal and CPECC and Tahara and Ted for being with us through our journey in Malaysia, and looking forward, maybe we can do more collaborations. But as Ted and Tara was mentioning, we probably need to do something different to touch more people, so that at the end of the day, we're looking at patient care and we want to improve that in Malaysia. So maybe we can have more collaborations in small settings. Thank you for inviting us.
Thank you, Dr. Jannah. Jannah, would you like to say any final comments?
Yeah, sure. Thank you for just bringing CPE to Malaysia. A lot of people have been working hard behind the scenes, especially Dr. Kamal, Dr. Jannah, and having both Ted and Tahara was really an excellent journey for me in my spiritual care. I was just sharing to Dr. Diana, I think yesterday or last 2 days, that it would really be a dream come true for me to be able to do 1-year residency with all of you there. But, being a clinician and doing chaplaincy at the same time, we are like really, I think something new for us. But as I mentioned to Dr. Diana, there's really a real need of spiritual care training in Malaysia. Not a lot of people can understand and see it, but as we went through the training, we know that there's more for us to learn. And I really hope that I can join for further training in the future. And I really hope that, having that collaboration that Dr. Jannah said can really expand the awareness of spiritual care to others in Malaysia, especially those working in a hospital in the clinical setting, and not just for the chaplains, but also for the clinicians. So that I think for myself, as a personal note, giving clinic, providing care to my patient has not been the same. It has been more enriching for me after I went through my CPE journey. So I have this hope that I can expand similar journey and experiences with others in Malaysia. Yeah.
Thank you, Jannah.
I think CPE really focuses on all of us being lifelong learners. And Dr. Jannah, the way you talked about you and Amy sort of sharing and comparing notes, I mean, my hope would be that you've learned a model for a different way of learning, and that you might, just pair up with one of the other group members and continue the process even among yourselves. You don't have to have an educator to continue to do self-reflection, to give feedback to one another, and to, learn. So it's a model for learning. And I mean, I'm retired, but I'm not ready to quit learning. And this was why this was so attractive to me, and why it was so wonderful to work with Tahara and with all of you all. That's what made it so rich. And I'm grateful. Thank you for being so open.
Thank you, Ted. Tahara, would you like to offer last words?
Just on a personal note, as the only Muslim woman educator, excuse me, I've often been the only Muslim in my group. So I just had my first Muslim student recently. So to have a CPE group that was all Muslim was very unique for me. And it was a gift. And so I just want to thank everyone come out for the opportunity, Ted, for your partnership and learning with you, and to Dr. Jannah, Dr. Noor, for getting to know you and trusting me, with your lives and your journey, and all the rest of the peers who are in the group. Just thank you for trusting Ted and I with your learning. Thank you.
Thanks.
Can I have one more question?
Yes, please.
Especially with the fact that Tahara and I, different faith, different race, etc. And I think we really did work together well. But I wonder, from the students' perspective, if they noticed any particular benefit from having two supervisors at the same time. I mean, it felt rich to us, but I wonder from the students' perspective if it helped to have a woman, a man, a Muslim, a Christian. I'm retired, old, she's young, and so we had a lot of diversity.
And we had a lot of fun too.
Enriching.
Yeah, it was very helpful. Yeah. Having
we loved having you guys together. You work very well together.
Yeah.
Then we have to bring them both to Malaysia.
Yes, definitely. We are waiting for all of you to come here.
Yes.
This has been an inspiring time, morning for you, evening for some, late afternoon for us here on the West Coast. We thank all of you for joining, for sharing the journey into chaplaincy, for bringing chaplaincy into Malaysia. And this program is part of our commitment as Interreligious Chaplaincy to highlight how this model of chaplaincy will work, both interfaith and intrafaith, how we can inspire people so they can reflect on their own understanding or on their own approaches of their faith, how they can develop new ways to connect with the people that they care for, and how to navigate institutions as leaders. Chaplains are part of the fabric, and definitely after or during the pandemic, were highlighted both as essential part of the community. Spiritual care is not a commodity, it's an essential part of living. It is needed on all levels, and for the providers to take care of themselves as they care for others. Again, it was our honor and privilege to host you at the GTU. We will connect with you at a later time. To our audience, thank you for sticking with us during this hour, and we hope to see you in another program. Thank you.
Thank
Thank you.